On a very regular basis, as a psychiatrist, I prescribe a medication for Alzheimer's disease. Yet, I don't treat a single patient with Alzheimer's. And I'm not the only psychiatrist doing that. So why is that? More and more psychiatrists are adopting Memantine, not for memory loss, but instead for OCD, along with various compulsive disorders like skin picking and hair pulling. And for those of you who are new to the channel, welcome. I'm Dr. Robert. I'm a board-certified psychiatrist. And today I'll be talking about this medication, Memantine. I'll be talking about why we're using it more often, and more importantly, what it tells us about OCD, compulsions, and mental rigidity in general. That feeling when your brain just gets stuck. Let's start with what Memantine actually does in the brain, because that's where the story gets interesting. Most medications for your mental health, like SSRIs, antipsychotics, anti-anxiety medications, stimulants, and many others, typically work on a few neurotransmitters. Think serotonin, dopamine, and a couple others. But Memantine is very unique in that it works on the neurotransmitter glutamate. Glutamate is the brain's main excitatory neurotransmitter. You can think of it like the on switch on brain cells. It's involved in learning, memory, attention, and basically how information flows through the brain. And as you can imagine, the brain is very sensitive to glutamate levels. Too little and everything slows down and can't get started. Too much and the system becomes noisy, rigid, and overwhelmed. Memantine works by partially blocking NMDA glutamate receptors, so basically where glutamate binds and turns on cells. But it's interesting that it only does this partially and typically when the cells are overactivated. That's an important point. It doesn't shut things down, it doesn't stop communication in the brain, it just modulates it, tones it down when there's too much. You can almost think of it like a noise filter. This medication was used in Alzheimer's disease for many decades and still is because there is a lot of neuronal stress in Alzheimer's. There's overactivity of glutamate in the system causing excess signaling and a lot of issues with memory and other problems. This medication can, to a degree, dampen that down. And it's still used, but the effectiveness is debatable. It doesn't work for everyone and it doesn't stop the disease, just slows it or dampens some of the symptoms. But clever psychiatrists have come up with their own use for it. And here I definitely want to give a shout out. I was lucky enough that in my residency program, some of my mentors, people I looked up to, worked with very frequently, Drs. Grant and Esson. I actually got to work with them and they published some really fascinating, really great papers on how this medication can cut down on compulsions. Most specifically on skin picking and hair pulling. And that's where I was inspired to first start using this medication with my patients in my private practice. And I've definitely seen huge benefits for some people. But to fill you in on basically what this medication is being used for these days in psychiatry is it's being used for a lot of just mental rigidity, a lot of compulsive, rigid behaviors. So I want you to think about things like I mentioned, skin picking, hair pulling, but also OCD where intrusive thoughts come up and they're very sticky, they can be very rigid sometimes, and they're hard to let go of. It can also be used in autism where rigidity and overstimulation is a problem, as well as in some of the symptoms of schizophrenia. But next I want to share with you what some of my patients tell me when they start this medication. They rarely say they suddenly feel happier, calmer, less depressed, or anything like that. And they certainly don't feel sedated or dulled like they can with some other psychiatric medications. Instead, what they'll say is, I feel like my intrusive thoughts, they're still there, but I can kind of move on from them. I no longer get stuck on them. I still have an urge to pick my fingers, pull my hair, but it's much less pronounced. I can maybe pause and not do it. So as you can hear, these things still occur, but there is more bandwidth to sort of not engage in them, not get stuck on them. The rigidity around them lowers. That's an important also clue as to what is going on in these mental health conditions. It's not the presence of these intrusive thoughts or these urges that is the main problem. It's the inability to let go from them or not engage in the compulsions when the urge does arise. Basically, the brain's inability to disengage, to shut off. Let's focus in more narrowly on OCD and compulsive behaviors. As many of you viewers know who've watched this channel, I definitely work a lot with OCD, compulsive behaviors, so definitely I will give you my insights into this. And speaking of insight, OCD is rarely a problem of insight. Patients with this condition, they'll know that their intrusive thoughts, their compulsions, a lot of them don't make sense, they're not very rational, but that doesn't matter. It's still there, it still triggers the anxiety, it still triggers the fear response or the urgency to know, to resolve something, to resolve a sense of dis-ease or dispel a sense of incompleteness. From a neuroscientific perspective, what drives a lot of OCD is this neurocircuit that allows for detection of errors and threats, being very overactivated and firing in a single loop and not shutting off properly. We all have these loops to some degree. It allows us to detect threats, notice when something is incomplete or not right. In OCD, this is overactivated, and glutamate plays a major role in these loops. It basically activates them. So when memantine dampens excess glutamate signaling, something very interesting and fascinating happens. Patients describe less rituals, a delay in compulsions, less sticky, intrusive thoughts. But here's a very important point, very important disclaimer. Memantine doesn't replace therapy or other medications like SSRIs. I almost always use it in conjunction with those other two components as well. And the way I describe it to patients is it allows you to become less rigid, it allows intrusive thoughts to be less sticky, urges to be less intense when it comes to compulsions, and so it allows the therapy to take hold more. It allows you to better engage in the therapy. And oftentimes it'll also make this SSRI work more. But in certain situations, I'll also use this medication if for whatever reason a patient can't tolerate an SSRI medication, which sometimes happens. So like many things, it's just one tool in the toolbox to address mental health symptoms. It's not a one-all solution. Nothing is. And that leads me to the limits and trade-offs with this medication. One is it can cause some side effects for some people, though I will say it is pretty rare. I use this medication all the time and I very rarely run into patients having issues or reporting any side effects, though sometimes some mild emotional blunting, some nausea can come up as well. Some other reported side effects are dizziness and headaches, though I haven't heard that very much. So it is on the whole a fairly side effect neutral medication compared to the alternatives. A lot of my colleagues who also work a lot with OCD are using this medication more often as well. And I would say the main side effect is the disappointment when it doesn't work, because not everyone benefits from memantine. I have patients who have really severe intrusive thoughts, skin picking, hair pulling, and we kind of hope that this might happen, that this might improve some of those symptoms, but it doesn't pan out in the way that one would hope. And I think that's the main thing to mitigate, is not get people's hopes up too much with this medication. But if needed, if symptoms aren't going away with other interventions like therapy, other medications, this can be a useful thing to introduce potentially. And then work on seeing, does it help, does it not help? And of course, working with your doctor if you are starting this to see, are there any side effects? What dosage are you on? How long are you taking it for? And have them guide you through that whole process of trying it at an adequate dose for long enough to see if it improves things. But I think there's some really interesting takeaways from this medication. Just learning how it works teaches us so much about the brain. Because glutamate, believe it or not, it's one of the more common neurotransmitters in the brain. Far more common than dopamine, norepinephrine, serotonin, the other neurotransmitters that are targeted by various medications. So it's very common. And yet, there are so few medications targeting it. I can think of memantine, and ketamine is another one that works on NMDA receptors. But otherwise, there aren't too many. And it definitely shows that this overactivity of certain circuits can be reduced with this medication. So perhaps there are other medications that may come out in the future. Because remember, memantine also came out in the 1960s originally. It was used for diabetes back then and didn't work at all. It was adopted for neurological implications in the 80s, 90s. Alzheimer's, it was approved, I think, by the FDA in the US in early 2000s. And I think that there's a lot more research that can be developed from our understanding of how memantine has affected mental health. Also clues us in to the degree that rigidity, the brain's inability to let go or deviate from a certain path, a certain circuit, a certain thought process, can cause suffering, cause distress in these various mental health conditions. My friends, if you found this helpful, informative, useful, definitely let me know in the comments below. Let me know if there's any other topic, medication, intervention that you'd like me to talk about. I would definitely love to make videos about it in the future. And I really appreciate you watching to the end. It means a lot. Please like and subscribe, and I hope to see you next week.